This is a contrast non-CT scan of a 62 years old male patient who is suspected of having myasthenia gravis and is being investigated to exclude the anterior mediastinal mass or a thymoma. Now please see this mass in the anterior mediastinum. In its upper part, it has partly surrounded the medial part of the brachiocephalic vein. It extends downwards along the anterior surface of the arch of aorta. It almost surrounds the 40% diameter of the ascending aorta. Now this is the superior vena cava. Its anterior part is surrounded by the mass. Nodular calcifications are noted in it. I have not shown you the plane scan, but the mass shows slight non-homogeneous enhancement. Please observe its nodular right lateral border. This is extending into the adjacent lung. This one here. Later I will show you the lung window. It extends downwards along the ascending arch of ascending aorta and ends almost at the level of the upper part of right atrium, where superior vena cava joins the right atrium. This one here. I will scroll it back again. Sub-centimeter sized mediastinal lymph nodes are present. These most probably are the inflammatory in origin. Now I will show you the lung details. Now please observe the nodular right lateral border, which is extending into the adjacent medial part of the anterior segment of right upper lobe. Now there is interlobular and intralobular septal thickenings. Although the findings are very subtle, but they are suggestive of early interstitial lung disease. Please observe the tubular configurations of these bronchi in the anterior segments of both upper lobes, suggestive of early traction bronchiectasis. Small interlobular, intralobular septal thickenings. Please observe these tubular configurations of bronchi, which are extending quite to the periphery of the lung in both the segments of right middle lobe. The interlobular and intralobular septal thickenings are relatively more marked in the lower parts of the lungs. So these are suggestive of the, please observe these small air-filled lucencies. This one here. Involvement of right lower lobe is relatively more severe. Air cysts inside the lung. So there is early interstitial lung disease, and the patient most probably has the invasive thymoma. The way it has partly encircled the ascending aorta, middle part of the brachiocephalic vein, and anterior part of the superior vena cava. This most probably is the cause of the myasthenia gravis. Now please observe this nodularly enhancing gland. This most probably represents the hemangioma. I'm sorry, this is the last limit of the scan, but its appearance is that of the hemangioma.